How to read an elbow X-ray. In this video we are going to learn the basics of reading an elbow X-ray. So elbow X-ray is done in AP and lateral views. So when we are reading the AP view, we should know about the anatomy. So this is the distal humerus and this is trochlea. On the lateral side is the capitellum, and we can see the proximal ulna with the olencrinon going behind the humerus in olencrinon fossa, and this is radius with radioulnar joint, and then going proximally with the radial neck and then radial head. And now if we go on the lateral view, we can see distal humerus with trochlea and capitellum superimposing on each other, and this is proximal radius with radial head, and this is the ulna with olencrinon and coronoid process of ulna in front. Now let's zoom in a little bit and see. Can you see this black area in front of distal humerus? So this is known as anterior fat pad, and this is the posterior one. This is known as the posterior ear, and sometimes you can see a posterior fat pad in this area in case of fracture. So now see the AP view. In AP view, we need to make sure all the cortex is continuous. There is no break in cortex. Run through the cortex, go to the radius head and go to the proximal ulna. Once everything, then go in a lateral view. Again, make sure all the cortex is regular all around radius and all around the ulna. After checking the radius and ulna, in adults you can check the radiocapitellar line, which is a line drawn through the radial neck and going through the capitellum. If in a normal patient, this line should cross the capitellum. If this line is not crossing the capitellum, it means there is a dislocation of radial head. Okay. There is another line in case of kids, not in adults, which is known as anterior humeral line, which you draw like this. In those kids, capitellum is still not fused to the humerus, so normally this line should cross capitellum in a way that 1/3 of capitellum lies anterior to the line. But if a kid has supracondylar fracture and capitellum displaces posteriorly, and this line will not have 1/3 of capitellum anterior to it. But this line is not used in adults. Other than this line, we need to see the anterior fat pad. If this fat pad is elevated like this, then it means there are chances of fracture. Similarly, there is no fat pad in posteriorly. If you see a bulge over here, anything black, so an elevation of anterior fat pad and presence of posterior fat pad points towards a fracture. In case of children, chances are this is an undisplaced supracondylar fracture, whereas in case of adults, there are more chances of an undisplaced radial head fracture. So after doing all this, don't forget to see through trabecular pattern for any pathology, to see towards the soft tissue, and similarly laterally. So this is all about elbow X-ray.